Dr. Withdrew is an internal and public health physician. He joins us here in Lagos. Glad you could join us on the program.
Thank you for having me.
Okay, I'd like to start with what we're seeing in Cross River State, finally recording 5 cases. Why did it take, the NCDC this long? Because, there have been several issues coming from Cross River State and then, the NCDC.
That is quite amazing. And to be honest with you, what I know at the moment is also what we all heard in the news lately. I really wonder why it took that long for them to record cases. It's a good thing that the health workers at the University of Calabar Teaching Hospital were able to come up quickly and raise the alarm for why, the NCDC had not even reported any cases throughout Cross River State. Yeah, so at this moment, I wouldn't really know exactly why it took them so long when most of the states in Nigeria had actually reported cases. So I'm sure there's something it needs to be looked into. It's something that needs investigating.
Another thing that comes to mind is, don't you think that the state has lost more time in terms of contact tracing of those who are already infected? Because, it kept insisting for quite some time that it didn't have COVID-19.
Obviously. And sometimes that's what makes it a little bit more dangerous. You see, sometimes when you deny the fact that you have an issue, you lose time, to be able to react to make sure that you have preventive measures in place.
In Ondo State, we have doctors withdrawing their services, and these are doctors where cases of COVID-19 are being managed in the state.
Yes.
And this is not the first time.
Yes.
We've been having doctors, even in Lagos, medical doctors, complaining about welfare, complaining about, insurance, complaining about PPEs.
Yeah. So, so that brings to mind why we now regard our health system as a very fragile system. Because if you look at the pillars of health systems, one of the major pillars of health systems are health, health financing and human resources for health. And that financing needs to be available to take care of the healthcare workers who are frontline, who are there to deal with the problem. And recently we've heard that the Federal Ministry of Health had approved a good remuneration package for healthcare workers, especially in terms of call duty allowances, hazard allowances, and all of that. But I think there's probably still an issue in the time lag it would take for them to implement those things. So I think there has to be room for discussion between the healthcare workers and the authorities.
And perhaps a little bit more in the state's response.
In the state's response, exactly.
Workers.
Exactly.
So tell us, with regards to, the virus spread in Nigeria, how are we doing?
I would say in comparison to the other parts of the world where the virus has gone haywire, we're doing quite well. But that's not to say that we should rest on our oars. And that's because I realized that we probably learned very good lessons from our approach to the Ebola outbreak. So the response that we had was quite immediate, and then we were able to get things under control. So generally speaking, we've done quite well, but it still remains that our health systems, our systems are fragile, you understand? And so we need to depend more on preventive approaches than trying to take on the virus head on.
So if you were to advise Nigerians now, what should they be doing?
So this is the time for people to actually change their behavior. You need to take personal responsibility. The health and safety measures that have been recommended by all of the authorities, the WHO, the CDC, are very clear. The Presidential Task Force for COVID has said it, try and avoid crowds. If you don't have any reason to make contact with people, avoid it. If you have to be in a crowded place or make contact with people, wear a mask or wear a face covering, and all of those things. Make sure your hands are clean all the time, wash your hands, keep a physical distance, and all of that stuff. And I'll also like to add that by way of personal responsibility, we need to make sure that we're also keeping our health, in tip-top shape, so that our immune systems, which are the basic defense systems that are built into our bodies, can help us overcome, the virus in case we get infected.
All right, we appreciate your time. Thank you so much, Dr. Withdrew, internal and public health physician. Thank you for joining us on the program.
Thank you for having me.